We first started to notice a serious issue with opioids amongst our membership. Probably going back into 2010, 2011, we were operating a national drug testing program in conjunction with our contractors and our clients. And we started to see our positive drug tests where traditionally you'd think marijuana or cocaine use would be the preponderance of them, but all of a sudden we started to see we had more people testing positive for opioid use than we did for the other drugs. At the time, we didn't have a lot to make of it. We didn't really understand what was going on.
The first opiate was from a poppy plant and produced what was called opium. And from opium, many new products were made, morphine and things used in medicine. Those were called opiates that were derived from the poppy plant. From 3,000 years ago, we knew they helped pain. But even 3,000 years ago, they also knew that people would feel good on them and that that was a problem.
Several years ago, we embarked on a study to look at opioid-related overdose deaths by industry and occupation. We have community partners around the state, and several of them were looking at their death certificates and they were saying, we're seeing lots of workers in the trades, mostly construction workers, but other blue-collar trades. So we said in occupational health, we look at the death certificates all the time by industry and occupation, so we can look at this for you. Let's look at it statewide. So we undertook this study to look at opioid-related overdose deaths by industry and occupation. We decided to go beyond just counting the deaths and the rates, but also begin to explore what could potentially be some of the contributing factors that might account for these differences.
So when we saw this high rate of opioid-related overdose deaths, one of the first things we thought about was, well, what are construction workers? What do they experience at work that's different or worse than other workers? And the first thing our minds went to with the Occupational Health Surveillance Program is occupational injuries. So construction workers have much higher rates of occupational injuries at work, but also fatal injuries at work compared to other workers. We also know that construction is a precarious industry in a lot of ways. Workers don't always have a guarantee of work, especially if they're non-union. So we thought that that precarity might contribute to the need to work in pain, for instance. Working in pain might contribute to using opioids in order to not be in pain while you're working, and then also might lead to misuse down the road.
It's a hard business that we work in. It's injury, there's no time off, there's no sick time, there's no paid vacation, so to speak. And, they work through their injuries.
I think construction industry as a whole has a much higher risk because of the work we do. The wear and tear on the body, the physical pain that most of our members go through, and not knowing how to deal with it.
Before becoming a union iron worker, I worked as a laborer. What got me into the drugs were from doing all this manual labor, I would get hurt or go through pain, put in a hard day's work, and I needed something stronger. Something to numb not only my physical pain, but the one mentally that was going on up here. I hit a very low bottom due to these drugs, and I was just stuck in this vicious cycle with no solution.
Our jurisdiction is New York City and Long Island. I started following overdose rates in Long Island around 2006 and watched it jump from 40 a year to 68 to 120.
There's one study that was done in Massachusetts of commercial construction workers where 70% reported working in pain, and in that same study they reported high prevalence of mental health issues. And one of the hypotheses that those authors had was that construction workers don't necessarily seek the help they need when they confront psychiatric problems or stress.
I think construction workers don't seek help as often as they should, and I think this is true for any industry. It's fear. We're all full of fear, and we all fear what other people think of us, or we fear success, we fear change, we fear failure. But I think fear drives a lot of people to not seek help, and in particular in construction, I think that you're around a bunch of manly men, tough guys, and you're building cities, you know, to come forward and say, hey, I'm struggling with such and such a drug or an opiate or alcohol, you always think the person next to you is going to think less of you, and you know, you're not going to fit in.
The question of how we approach addictions today has shifted. You will hear people say it's a medical illness, and so that's called the medical model. That's what we call, it's purely physiologic, meaning it has to do with how the body is working and reacting. In psychiatry, we go a step further and we look at what's called the biopsychosocial dimension of an addiction. What that means is bio would be genetic. Psychosocial has to do with the psycho is your temperament. Some people have hot or cold temperaments, if you will. And then the last one, which is probably the most important part for everybody to know about, is the social setting. Did you grow up in an abused child relationship? Did you grow up in a neighborhood where drugs were prevalent? And of course, for construction workers, the tough thing is high demand, high stress, a lot of bodily injuries, and the availability of opioids. And so that's the social setting.
The nature of the business is we get banged up, we're in pain. There's a lot of drugs on the jobs. A lot of guys are using. It's easily accessible. A lot of the guys have the mentality, we work hard, we should play hard. And the overdoses started becoming more rampant with the fentanyl, because the heroin's kind of disappeared, and that's primarily the drug of choice now.
Somebody working under the influence of opioids in the construction business not only puts their life at risk, but puts the lives of their coworkers at risk, and potentially the public as well.
There's not a day that goes by you don't turn the news on or open the newspaper and it's right there. So it's every single day we see it. We're trying on the defensive end and trying to just figure it out, how to handle, get that person, get them healthy and get them back to work and being safe.